This is Carl and Tina. Carl and Tina are looking to undergo IVF. To start, both Tina and Carl had to have a physical exam. It was free, but they had to wait almost 3 months for the insurance to schedule the appointment. Then Tina had to undergo a blood test. She had to pay out of pocket for it because her IVF specialist doesn't work with her normal OBGYN. IVF specialist hadn't even seen her lab results but ordered a 3D ultrasound to be conducted so that Tina's internal organs could be examined. Carl got 2 different bills in the mail, one for the 3D ultrasound and one bill so that a doctor could review the 3D ultrasound results. Even though a doctor reviewed the 3D ultrasound, he didn't write up the medical note. The IVF specialist did not make any follow-up recommendations except to meet again weeks later. Carl had to pay, and Tina had to wait. After they waited and met the IVF specialist in a second consult, Tina was prescribed a series of hormone treatments. Their insurance wouldn't cover it because hormone therapy isn't in every IVF case and not included in coverage. After 2 weeks of hormone injections, Tina was ready for the retrieval process. But before she went to the procedure, the IVF specialist canceled the appointment due to his schedule. But Carl and Tina didn't hear back from the IVF specialist. Instead, they received a bill for the full amount of the hormone therapy drugs and then another bill for the second round of hormone therapy drugs. Carl was also told by his insurance that he needed to supply proof that only 1 retrieval was performed because the limit was 3. After that, insurance would not pay for the retrieval. It took months for Carl and Tina to get the correct medical documentation to prove that they did not get the egg retrieval process. Then, bad news. Too much time had gone by for him to move forward. Tina would have to start over with a blood test and a 3D ultrasound. Tina and Carl decided to follow a friend's suggestion and go to Taiwan, where the healthcare was less about the insurance agreement and more about the patient. The agency they contacted helped book appointments, apartments, and found them a translator. In Taiwan, all the services for the IVF clinic are handled in-house. They did the physical, blood draw, ultrasounds, semen analysis, all in the same building on day 1 and 2. Even medication was given at the receptionist desk. They retrieved an egg, created an embryo, and performed a state-of-the-art PGTA test on their embryos 2 weeks later, and then implantation 3 weeks after that. The total cost of the IVF cycle was under $5,000. Check our website, taiwanmedtour.com, to learn about healthcare based on quality and not insurance contracts.